Buenos dias. So I'm here in Madrid in a beautiful, convention center, and I'm really amazed at the hospitality and the whole area of Madrid. It's been a long time since I was here. I think about 4 or 5 years ago, and this looks fairly new to me, maybe 3, 4, or 5 years old. Anyway, I have only a minute or two to talk to you, so I don't want to waste too much time at the intro. I was invited by Dental Excellence, a new organization that's putting on a wonderful 2-day meeting, and I have a lecture and 2 workshops. But this first interview, I've been asked to summarize the main teaching points of the lecture that I gave yesterday. My lecture was entitled Contemporary Ceramics, and the main point that I was talking about really all ceramics. So we won't talk about metal ceramics, even though we know that they do work today, even in 2017. So if we could break it down into its simple components, we still have feldspathic porcelain that we would use in certain circumstances because we can use it conservatively. We would use it really only on anterior teeth for porcelain veneers. In clinical situations, the ideal clinical use is when we still have mostly enamel on the tooth. And having done thousands of veneers over the years and really looking at the literature, they do extremely well, again, when we have mostly enamel. That number seems to be about 70% or more remaining enamel. And then over the last 10 years or so, we've seen an explosion in glass ceramics, specifically Emax ceramic, the lithium disilicate, and there's been clones. A very high-strength ceramic that's doing very well in clinical situations. We can certainly use it in the porcelain veneer situations, but it works exceptionally well in situations where we don't have as much enamel, or maybe when we're dent and bonding, because it is a much stronger material. And so that would be my specific choice when I have less than, let's say, 50% remaining enamel, or for inlays and onlays. That would be my number 1 choice as the typical crown replacement in the posterior. Where I would have thought of doing a crown 20, 30 years ago, instead I would do a sort of conservative or partial bonded restoration out of an Emax material or lithium disilicate material. And then even more recently, we've seen a proliferation in zirconia materials. First, the tetragonal shaped or crystal material, which had some issues early on with porcelain chipping that were solved. And certainly that can be a good alternative if you layer it. And that would be a crown replacement or a PFM replacement, where we would use that type of material. But more recently, we have seen these newer generation materials that have an increased or altered content of crystal called cubic zirconia. It's a much more aesthetic material that we can use in monolithic form for inlays and onlays and monolithic crowns. It's new to the market, so we need to be a little bit careful on newer materials. The strength is about 30% less than the original material. So that's going to be the material that I'll use in place of the high-strength zirconia for monolithic material. So those are the materials we're using today. So that's the extended version of the 1 minute. Sorry, I went a little bit over time.